Hi everyone, this is Dr. Kim from Dr. Kim Virtual Wellness Clinic. I wanted to do a video to share a little bit about my new venture with you. I wanted to share what the clinic is about, how it might be of help to you or someone you know, and the why behind it. Why am I doing this? What is this thing I'm doing? Why am I doing it? So I'll start with the why. So why am I doing this? Well, I've been in healthcare over 20 years. I first started out 20 years ago working in cardiac pulmonary rehab with patients that had had post-heart attack. So they had had a heart attack, or maybe they had a stroke or a bad pulmonary lung diagnosis, and they're coming to us to get healthy after the big event may have happened. And at that point in time, I was an exercise physiologist working with those folks. And the one thing I noticed is they really wish they would have done something sooner. And maybe it was not smoking, maybe it was eating a healthier diet, exercising, whatever it may be. They felt like, man, I wish somebody would have talked to me about this sooner. I wish I could have prevented this heart attack, prevented this stroke, prevented this lung disease. And about 80% of all of our chronic diseases are definitely preventable, if not more. So instead of catching patients after it's too late, I thought, well, why don't we do something better on the front end? Why don't we try to work with people before they get here, before they have their heart attack, before they have their stroke, before the bad lung diagnosis? So there's so many things we can do, and that's why I'm here. I truly believe that we aren't doing preventive medicine well enough in this country. I think we've got a lot to learn and further to go. I have been also in primary care since 2011, and I can tell you that we can do better. In traditional primary care, I typically got about 10 or 20 minutes with a patient, and that was, usually max. And, you can't address lifestyle, get to the root issues of things with just 10 or 20 minutes with the patient. It's just not long enough. 78% of primary care visits are due to chronic disease. But in primary care, a lot of times we keep our patients trapped in that chronic disease. The majority of the time, actually, we do. So we say, hey, you know what? You have the high blood pressure, take this medicine. How long do I have to take it, doctor, nurse practitioner? For the rest of your life, patient. That's actually not true. If we can change people's lifestyle, improve their nutrients, improve the way their body functions, improve their overall health, they might be able to get off of that medication. They might not have to take it for life. If they have a diabetes diagnosis, especially diabetes type 2, that is, induced by lifestyle choices, then that can be reversed. It truly can. So we don't spend enough time on that because we don't have enough time. The current medical system has said you get 10, 20 minutes with your patient. You come in, you look at the numbers, you medicate to the numbers, you treat the body system in silos and on with it, right? So, people deserve better. And I have a name for you guys, Dr. Dean Ornish, if you want to Google him. He's amazing. And I kudos to him. He's one of my I guess you would say, just mentors. Even though I don't personally know him, I think what he's doing is wonderful. He has wrote a book called Reversing Heart Disease. He has helped with a movie called Escape Fire. I would highly recommend you watch that. And he's a cardiologist. He's a heart doctor. And what he's realized through his research of lifestyle medicine is that many of our chronic diseases do not have to be there. We can prevent them through lifestyle changes. And in primary care, the one thing we say, oh, we're doing preventive medicine. So we might get mammograms, colonoscopies, pap smears. These are wonderful screening tests. I'm all for them. I think that's, it's great. However, it's really not preventing anything. It's early detection. So early detection is great, but we need to go a step further, and that's what we're not doing in traditional primary care for the most part. So Western medicine or traditional American medicine, what we tend to do, and I've worked in it for 20 years, so I know it well, we tend to divide the body into parts and treat those parts in silos. we have had some wonderful advances. We have some wonderful specialists. I don't want to dog Western medicine because, my goodness, we've had a ton of advances. However, who is overseeing the entire body system? And also, our body doesn't work in silos. Each part affects the other. So we must remember that we take care of our health as a whole. The whole body system is greater than the sum of its parts. Your mental health is affected by your physical health and vice versa. So I've had patients come in and they're like, I have this horrible, debilitating anxiety or depression. In fact, usually if you have anxiety, you have some depression, they're best friends, they run around together. That's what it is. One can tend to drive the other. However, what people don't notice is it might be what they're eating. It might be that their body is inflamed or toxic. It might be that their nutrient levels are off. It might be that their microbiome is completely jacked up. And so if we fix those things, then their mental health gets better. Do you know you produce more neurotransmitters in your GI tract, which is your intestines, than you do in your brain? It's crazy to think that. And most folks don't really think of it that way. Some do, but it's all connected. So we have to do better in medicine. We can't just keep treating our body parts in silos and expecting to have these wonderful outcomes. And did you know we spend more money than any other country does on healthcare? So you would think we'd be the healthiest country in the world, right? We're not. We have so much work to do. And I personally believe, and forgive me for looking at my notes, but got some important points I want to share. I personally believe that where it lies is in functional medicine. I personally believe we need to have longer visits with the patient. We need to really talk about how are you sleeping? How's your stress level? What types of things are you eating? What types of things are you not eating? We need to test, is your body inflamed? Is your body, toxic? Have you had some sort of exposure that's really making you sick? Is your microbiome or your gut health, your intestinal health off? And that's why you're having all of these other issues. Hormones, oh my gosh, hormones. And so that's a big buzz thing right now. And as a 47-year-old woman, believe me, I am very interested in hormones. But hormones are so complicated. We have way more than just estrogen and testosterone. We have a lot of other hormones, and we have them affected by every body part. So if you're running off to the latest, greatest fad doctor, and they're like, oh, you are this age, you get this much estrogen and this much testosterone, and we're gonna fix you. Well, they're missing a piece of the puzzle. A lot of people might need some hormone replacement, but are their hormones off because they're toxic? Are their hormones off because of what they're eating or not eating? Are their hormones off because their gut health is a mess? Maybe they have some infections in the gut that needs cleared up. So it's all connected, and we have to do better. We have to have providers that look at that whole body connection. That's where it's at, and that's why I opened this clinic is to really help folks get to the root cause of what's bothering them, to be their healthiest, to have energy, to go out and enjoy life, to have their mental health and their physical health come together in a synchronous way that they haven't ever had before. Life is short. We want to really enjoy the amount of time we have in this life. And in order to do that, it kind of is important to be our healthiest. So we all know we've been affected by illness. You're just not having that quality of life. So it's really important to get to that root cause of the problem. And so I think I've demonstrated to you kind of the why. The why is I'm frustrated with our current medical system. We do a lot of things good and well, and major advances and wonderful specialists, and thank God for them, truly. But we've got to get preventive care and lifestyle medicine front stage. We've got to get insurance companies paying for this type of thing, which currently, by the way, they don't do a really good job of reimbursement. So in America, it's actually your insurance will pay a little bit better if you're getting traditional sick care. So if you are on blood pressure medicine for your hypertension, that's a lot of times covered. But if you want to come to someone like me and get functional medicine testing and really see what your body's doing on the inside and really fix it and really turn your body around, well, insurance doesn't want to pay for that. So that's really frustrating too. And that's a different soapbox. Perhaps I should do a video about this, but I wanted to share with you that those are the things I'm addressing. And here we go. So I've opened my clinic to make some positive changes in healthcare. You deserve more. You deserve the time and investigation it takes to make your body, mind, and spirit healthy. At my clinic, you will receive 60 to 90 minutes for your initial visit, and any other visit you might need that amount of time, you got it. We will determine gaps together, and we will investigate your health concerns, and we will say, okay, where are we at? Through functional medicine testing and lifestyle coaching, you can truly become the healthiest and happiest version of yourself, which is what I'm so passionate about. We can truly prevent chronic disease in your body instead of just throwing more medication at you. Surprisingly, a lot of my patients, I've been practicing this way for quite a while, and decided to really put it front stage. I mean, I was the one back in primary care in 2011 handing out my supplement handouts, and a lot of my patients were already fixing nutritional gaps they had, and I had some of the MDs coming up and saying, oh, let me see that supplement handout, or hey, this patient's taking this, what do you think about that? So this is nothing new to me. I'm just putting it front stage and saying, we got to do better. Here we are. Let's really do some good with preventive care. And surprisingly, this is what I was going to say, you might get off some medications. So I've had some patients, many patients actually, reverse some chronic disease that they've had, and they've gotten off medications. So what do we do here at Dr. Kim Virtual Wellness Clinic? So we do functional medicine, preventive care, and general wellness care. What is functional medicine? Well, here is a definition from the Institute for Functional Medicine from 2022, and it is functional medicine is a systems biology-based approach that focuses on identifying and addressing the root cause of illness. Awesome. What the hell does that mean? So what that means is, simply put, functional medicine gets to the root cause of your health problem. The root of physical or mental illness nearly always lies in a part of the body not functioning ideally, right? So through functional medicine, evaluation and testing and treatment, we can change the course of your health for the better from the core. So what are some of the things that this clinic does? So we do body toxicity testing and treatment, body inflammation testing and treatment, hormonal testing and management of deficiencies and imbalances. We do food sensitivity testing, SIBO, so there's small intestinal bacterial overgrowth. It's much more common than people realize. You might not have ever heard of SIBO. You can Google it and find out a million things about it, but a lot of folks have SIBO, and so we can test for it here, we can treat for it here. Nutritional testing and treatment of deficiencies, weight loss counseling, anxiety or depression management, mild to moderate, preventive testing for early detection of chronic illness and disease. So am I a proponent of the mammograms? Am I a proponent of the colonoscopies? Yes, 100% happy to order those for you. I think those are definitely something that are important, but let's be real, they're early detection. They're not truly preventing anything. So the true prevention is where we get to, what's your nutrient status? How's your sleep? How's your stress? How is your whole body coming together as one? Also, we do natural pain relief options for folks that are in chronic pain. A lot of times just realigning your body's nutrients, getting you rebalanced is going to help that pain. However, there are a lot of wonderful alternatives to opioids. We also do medical cannabis evaluations here, at least in the state of Minnesota. And that is a modality of pain management that can be very helpful to some folks. And it's much more natural than some of the other treatments that are out there that can be very addictive. So questions for me, some common questions I've had. Do I prescribe medicine? Does this clinic prescribe medicine? And I say we because I rely on other folks to help this clinic, work. And it is my hope to bring on other like-minded providers in the future and offer these things. So it's a we thing. So with that said, do I prescribe medicine? Sure, if you need it, I can prescribe medicine to you. This clinic has a lot of overlap with primary care. We can treat many chronic diseases, anxiety, depression, natural pain management. If you need to have an in-person visit, you can be referred to the appropriate provider for this type of visit. We offer lab testing, imaging. We can refer out for many types of specialties when needed, but 80% of primary care issues can be handled through telehealth. And I offer online scheduling for ease of access for you. So, telehealth is kind of where it's at nowadays. It is really nice and convenient. You can go online, you can make your appointment. You don't have to even leave your house. We can have an appointment anywhere you wish. Maybe you're at work and you take, a break at work and you want to have a visit. Cool, we can do that. It's not a problem. There is a lot we can do through telehealth nowadays. It's actually pretty amazing. So I would say I'm interested in helping you get to the healthiest you that you could possibly be. I'm very interested in helping you maybe move past some problems you've had with maybe weight loss, with maybe depression, anxiety, or just not feeling 100%. When you kind of know you have that nagging thing inside of you, it's like, I can feel better. I can do better. What is it? I'm not getting what I need. Well, if those are thoughts you've thought, come see me. I would absolutely love to help you. And so please visit my website to learn more. It's drkimwellness.org, all one word, no periods. So drkimwellness.org, and check it out. Again, would love to see you. And if you want to learn more about what we do, our fees, our services, etc., again, just everything's online for you, and you can make an appointment right there. Would love to hear from you, and you can message at the website any questions you might have about the practice. And we're here for you. I'm here for you.